We are now being recorded. Hello everyone again. My name is Alejandra Aguilar, gender pronouns she, her, hers, statewide prevention program specialist at the California Partnership to End Domestic Violence. I am so excited to be here with you all and our partners, California Work and Family Coalition, Legal Aid at Work, EDD. This is a huge time for us to be having this conversation. Folks were asking me, why is the Partnership to End Domestic Violence involved? Financial stress is a huge risk factor for violence at home. We are seeing cases of domestic violence rising, and it is important for us to show up and make sure that we share information with the community in a way that is accessible and easy to understand. And that is what today is about. Making sure that folks know their rights, making sure that folks have access to the information they need. We know we have advocates on here, organizers. If you wouldn't mind just typing into the chat, who are you? Where do you work? Why are you here? What interested you in today's conversation so that we see who is present? And it'll also help us figure out how to respond or address some of the items that will be discussed today. I do want to introduce our partners, making sure that everybody has an opportunity to hear them. So we have amazing partners on here today. I'm gonna show off the PowerPoint because we don't need that right now. I just love seeing the faces of you all on here. Organizers, advocates, prevention staff, preventionists from all over. Beautiful time for us to come together and share information for us, for family members, friends. I was sharing before we started recording, I've got family on here today. This is impacting all of us, whether it be the staff that we support or us directly are being impacted. So thank you all for being here. Again, I shared we're in partnership with the California Work and Family Coalition. Would you mind introducing yourself, staff from, where's Jenya at?
Hey, this is Jenya. Sorry, my camera is not working on this computer. So thank you very much, Alejandra. So we're the California Work and Family Coalition, and we're the statewide coalition working with many of the groups on this call today on expanding the right to take paid leave and paid sick days, especially now.
Thank you.
Hi, everybody. My name is Mia Hemstad, and I am the social media coordinator at the California Family Work and Family Coalition. And yeah, if you see any posts come out, that's probably done by me. And if you have any questions, reach out via social media, and I'm here.
Thank you. Katie?
Yeah, I'm Katie from the California Work and Family Coalition. I'm the political organizing director. I'll be quick so we can get into the
And I'm Melissa Koba. I'm the Director of Education and Outreach with the California Work and Family Coalition. Good to see you guys.
Thank you. We also have our partners, Legal Aid at Work. Would you mind introducing yourselves?
Hey everyone, I'm Jenna Gary and I'm a staff attorney with Legal Aid at Work, and you'll be hearing from me a little later on.
Folks from EDD, would you mind introducing yourselves? You're actually going to be up first to speak. So why don't you introduce yourselves while I set up your PowerPoint?
Hi, this is Katie Morales. I'm with EDD's Disability Insurance Branch. I'm an Education and Outreach Specialist, and we're happy to be here to be part of this conversation.
Thank you. So let me share this screen. If you wouldn't mind, we're going to save question and answer for after the EDD and Legal Aid at Work speak. You can also add your questions into the chat as people are sharing and speaking. We also have our partner, IDEPSCA, who will be speaking later in this conversation. So let's get started with EDD. Let me make sure that this is going to work. Okay.
Perfect. Thank you so much. So again, my name is Katie Morales. I am an outreach analyst with the State Disability Insurance Program. I'm here today so we can give you just some basic information regarding our disability insurance and paid family leave components of the State Disability Insurance Program. I am also going to provide you where you can get more information on the novel coronavirus or COVID-19 as it relates to our State Disability Insurance Program. Next slide, please. So state disability insurance is a partial short-term wage replacement insurance program under the Employment Development Department, known as EDD, for California workers. There are two separate plans. That would be disability insurance and paid family leave. Disability insurance provides partial wage replacement benefits to eligible California workers for their own illness, injury, pregnancy, or disability for up to 52 weeks per claim, while paid family leave, or PFL, provides partial wage replacement benefits to eligible California workers who need time off to care for a seriously ill or injured child, spouse, parent, parent-in-law, grandparent, grandchild, sibling, or registered domestic partner, or if they need to take off time to bond with a new child entering the family through birth, adoption, or foster care placement. Up to 6 weeks of benefits are payable in a 12-month period. However, we did want to note for paid family leave claims beginning on or after July 1st, 2020, benefits will be extended from 6 weeks to 8 weeks of wage replacement. And this will be for individuals who are taking time, again, to care for a seriously ill family member or to bond with a new child. We did want to note, as it's very important for us to put the word out there, that citizenship and immigration status do not affect your eligibility. And so we wanted to make that very clear. Next slide. We wanted to discuss how our branch is handling and responding to the COVID-19 situation that's ongoing right now. For Californians covered under California State Disability Insurance, benefits have been made available through DI and PFL for those that are affected by the novel coronavirus or COVID-19, as I'll refer to it. If eligible workers are unable to work due to having or being exposed to COVID-19, which must be certified by a medical professional, then they can file for a disability insurance claim. So again, for individuals who have to stop working because they have COVID-19 or have been exposed and are under a medical quarantine, and this should be certified by a professional, you can file for a disability insurance claim. For eligible workers who are unable to work because they are caring for an ill or quarantined family member with COVID-19, which also must be certified by a medical professional, they can file for a paid family leave claim. Updated information and a list of all available services and programs through the Employment Development Department, which include disability insurance, paid family leave, and unemployment insurance, can be located on the EDD's Coronavirus 2019 webpage or the Coronavirus 2019 Frequently Asked Questions page, which are listed on the slide here. So we want to talk about how to apply. There are two ways you can apply for a disability insurance claim or a paid family leave claim, which will be online or by mail. It is highly recommended to file a claim through SDI Online, as this is the fastest, the easiest way to submit claims. It reduces claim errors and processing time. In order to file a claim, you must be registered with Benefits Program Online and SDI Online. Tutorials can be located on our page, edd.ca.gov/disability, to assist with registration and claim filing. You can create or access your account by visiting the site edd.ca.gov/BPO. If you prefer to file by mail, you will need to complete the Claim for Disability Insurance, DI Benefits, Form DE-2501 for a disability insurance claim, or a Claim for Paid Family Leave Benefits, DE-2501F, for a paid family leave claim. Claim forms must be completed in their entirety, and all required supporting documents must be returned to the document in order for us to process the claim. For more information on how to complete claim forms, you can visit edd.ca.gov/disability. Claims, whether filed online or by mail, must be submitted to the EDD within 49 days of the requested start date for a DI claim and 41 days from the start date of your paid family leave claim. For more information on DI or PFL, please visit our website at edd.ca.gov/disability or californiapaidfamilyleave.com. You can contact the EDD at one of the toll-free numbers that are provided. DI information is available by phone in English and Spanish, and paid family leave is available by phone in English, Spanish, Cantonese, Mandarin, Vietnamese, Armenian, Punjabi, and Tagalog. For services in additional languages, please refer to the EDD website, edd.ca.gov/disability/contact_SDI. In addition to contacting us by phone, you may contact the department through SDI Online for DI claims or ask EDD to ask questions for PFL claims. We understand that in these unprecedented times, you may be experiencing longer wait times for both claims processing and calls to the department. We want you to know that EDD is doing as much as possible to reduce these delays. We encourage you to file your claims electronically through SDI Online to avoid mailing delays. With that, I thank you again for joining us, and I'm going to pass it off to my colleague who's going to speak to you about UI. His name is Gerald. Gerald, are you on the line?
Gerald, you'll need to unmute yourself, or let me check to unmute you.
Hello?
Yeah.
I apologize. I had a double mute. That's why when I was introducing myself, Alejandra started talking. I was like, I don't think they could hear me. I apologize. So I had a mute button and I had to do a *6. Okay, so I'm respectful of everyone's time. Unemployment insurance is the other benefit program under the guise of the Employment Development Department. Could we go ahead and move on to the next slide, please? Hello? Thank you. So unemployment insurance, in California, the UI program is funded solely by employers. It provides a temporary source of income, a wage replacement of sorts, to help meet life's basic necessities when eligible individuals lose their jobs through no fault of their own. Now, unemployment insurance is a unique program. It is based on federal law, but is administered at the state level under state law. There are basically 53 unemployment insurance programs in the United States. So the application process, who should apply? Individuals may file a claim for UI benefits as soon as they are no longer working or the hours are reduced. To be eligible to receive benefits, individuals must be out of work through no fault of their own, must be physically able and available for work, looking for work, and ready to accept suitable work. Now, I guess the main difference between disability and unemployment is basically if you're under a doctor's care, obviously you're injured or whatnot, then you file for disability or PFL. With unemployment insurance, if you're not under a doctor's care and you're unemployed or not working currently or working part-time, then you file for unemployment insurance. Now, as I mentioned, unemployment insurance is a unique program. It is based on federal law. Now, as a condition, unlike disability, what Katie mentioned, as a condition of eligibility, the federal government requires that an individual must have the legal rights to work in the United States. So non-U.S. citizens must have work authorization. So part of when you file a claim to expedite your claim is you need to have your work authorization number ready so that we can check off that part of the requirement. Now, what do you need to file a claim? So generally, so that we can expedite the process, you need to have a number of things available so that you can just enter the information if you do it online or whether you're calling in. So then your name, your social security number, your mailing and residence address if they are different, your phone number so that we can contact you if we have additional questions, the last employer information, including the name, mailing address, including your supervisor's name and a phone number for that employer. We also require the last date of work and the reason that you are no longer working. We also require your gross earnings in the last week that you worked, simply because there are certain people where they only work partially in a week, so we would need to know so that we can calculate whether you'll qualify for the whole amount or a partial amount depending on how much money you made. So we need to have all those ready. It's the gross earnings generally is what we need. Information on all employers the claimant worked for in the last 18 months. So unemployment is based on the past year and a half of employment. Part of the way we basically determine eligibility and find out your identity or an identity verification process is we also ask you who you worked for in the past year and a half. Some employees have multiple employers, so it will be beneficial to make sure it's expedited that you're able to verify who you worked for in the past year and a half, because these are the employers that are paying into the program on your behalf. Unemployment insurance is paid solely by employers. There's nothing that we as employees pay for. So it's only a tax paid by employers. We also need your driver's license number or California ID number. And again, your citizenship status, because it is a requirement under federal provision. So for the next slide, go ahead, please.
Sorry, it's a little delayed.
Oh, it's okay. So Katie has a similar slide. Basically, unemployment insurance also is available to Californians who have had their hours reduced, lost their jobs, or are subject to quarantine. Again, the main difference is if you're not under a doctor's care and you're unemployed or underemployed, you file generally for unemployment insurance. And we have basically the same links to the EDD site regarding the coronavirus and FAQs regarding unemployment insurance and in respect to the coronavirus situation. Go ahead and move to the next slide, please. So how do we apply for benefits? There are multiple ways when you apply for benefits. We can do online. Online is the fastest and most convenient way to file a claim, reopen a claim, or even certify for benefits. I'll talk about that in a little bit. It is available 24 hours a day, 7 days a week. It helps reduce delays due to common errors made on the paper application, because there are additional questions depending on how you answer our questions. It leads you to other questions so that we can clarify. So it is the most convenient and reliable. It's also secure, and after you file a claim, you also get a confirmation number as proof that you have filed a claim. You can also file by phone. Unfortunately, at this point, it's really 8 a.m. to 12 noon. The bulk of our unemployment insurance applications are done really via the online application. 70% or above basically is done UI online. So that's why this is what we're touting as the best way to file a claim is online. But if you absolutely have to talk to a representative, so we have representatives available during that time. Now, why is it only 8 to 12? It's because, again, the bulk of our work is really done offline, supporting customers via that contact us via online and all the applications that are received. So our staff are working hard. They're working before and after hours. And I'm sure you've heard the governor with his press releases, unemployment insurance, we're all hands on deck. We're also working on weekends. We also have brought other people who have moved on to other departments. If they have unemployment insurance experience, we're all hands on deck. We're bringing people in to help with trying to make sure that the claims are filed and paid. So that's what we're doing. You can also download the unemployment insurance application from our website, and you can fill it out online or handwrite and then submit it via fax or a mailing address. That's not the fastest way, but it's an avenue for individuals to also file a claim. Go ahead and move to the next slide, please. How are we on time, by the way? I know I only have 5 minutes, so I'm going as fast as I can. I'll back up a little bit. So one more, there you go. So for unemployment insurance, you file initially, but in order for you to get paid, every 2 weeks you have to what we call certify for benefits. So that's the next step. We have the same ways of certifying for benefits, UI online, by phone, or by mail. Again, the fastest would be via UI online or by phone. By mail you can do it, but also it's not the fastest, because then you have to account for delivery time, right? The snail mail. You have to put a stamp, and then you have to mail it. You have to account for the post office to deliver that to us. And then once we receive it, if you're eligible for benefits and you met all the requirements, then we authorize the payment. go ahead and move on to the next slide. Now, what I also wanted to add was because of the coronavirus situation, the governor has declared an emergency situation, generally for unemployment and I believe disability. The first week is not payable. It's called a waiting period. So he waived that. The first week that you otherwise qualify for benefits will be paid. Self-employed individuals, at this point, unemployment is based on wages earned under generally a W-2 employment. For self-employed individuals, at this point, you don't qualify for benefits. However, there is legislation currently in the works where the federal government may be providing additional benefits. It's called the Pandemic Unemployment Assistance. So for individuals who are self-employed, they may qualify for that. At this point, we're waiting for it to go through and through the process, have the president sign it, and once it's available, then we will implement it as fast as we can. Also, there's a potential eligibility for additional benefits on a weekly benefit amount situation where I believe it's $600 based on the latest information that I'm reading that's passing through Congress. So stay tuned for that. Once it's passed, again, we will be ready to implement. That's pretty much it. So I guess moving on to the next presenter, and I'll wait for questions later on.
Thank you so much. Yes, Jenna from Legal Aid at Work is going to be presenting next. We see the chat. Please keep putting your questions in. I know folks are also texting them, messaging them. So add them in. Jenna's going to help fill in a little bit more of the information, answering some of our questions directly. If you still have some, please add them into the chat. Thank you, Jenna.
Yeah, thank you, Alejandra, and thank you everyone for being here. So I'm Jenna Gary, and I'm a senior staff attorney at Legal Aid at Work. We're a nonprofit that's based in San Francisco, but we actually do work across the state of California representing low-income workers. So I just want to preface that I'm going to go through all this kind of quickly. I'm going to be telling you a lot of information, but don't worry if you don't get anything down. We'll not only share these slides, but all this information is going to be available on our website at legalaidatwork.org. So there's going to be chances for more information. Let me go to the next slide. Okay, so the EDD did a great job explaining state social insurance benefits, such as state disability insurance and paid family leave. So I'm just going to touch on other programs and laws within California that may help you during this time dealing with COVID-19. So the first is California paid sick days, which can be used if you yourself are sick with COVID-19 or have been exposed and are in self-isolation, or if you're caring for a family member who has been diagnosed with COVID-19 or has been exposed and needs to self-isolate or quarantine. Under California law, every employee is entitled to at least 3 paid sick days throughout the year. And some places that's more. So you'll see a list there, cities like Berkeley, Emeryville, Los Angeles, Oakland, San Diego, San Francisco, and Santa Monica actually require additional paid sick days. Some important things, so an employer cannot retaliate against you for the use of paid sick days, and these are paid directly by the employer. So as long as you're employed and you are an employee, you're entitled to them and your employer must pay them out to you. And they can also be used for preventative care. So if you need to take time off to go to the doctor because you're having symptoms, that also will be covered. So some additions to this is, so I'm sure many of you saw that on the 18th, Trump signed into law the Families First Coronavirus Response Act. So starting April 2nd, as long as your employer has fewer than 500 employees, you should be able to immediately access 2 weeks of additional paid sick days. Beyond the normal reasons that you can use paid sick days under California and local laws, these federal paid sick days can also be used if you're taking time off work to care for a child because of school or child care closure. These paid sick days are again paid directly by your employer, and starting April 2nd, you will have access to at least 2 weeks. If you're one caveat, so beyond if you work for an employer with more than 500 employees, you don't get them. But also if you work for an employer that has fewer than 50 employees, they may seek an exemption to providing these from the Department of Labor. And now I want to talk about another California law and federal law that may provide you with not paid leave, but job protected unpaid leave that you may need during this time. So the California Family Rights Act and the Family Medical Leave Act, the California Family Rights Act is simply our state version of the FMLA. And what these laws provide for is they provide eligible employees with up to 12 weeks of job protected but unpaid time off for 3 reasons. But the most important reason in this case is to deal with your own serious health condition or to care for a family member with a serious health condition. The coronavirus or COVID-19 is considered a serious health condition, but it would not apply if you're asymptomatic. So if you haven't yet had an actual diagnosis or symptoms and are like self-isolating, this wouldn't apply to you. But for people who do have a diagnosis or do have symptoms and are being treated, you will have up to 12 weeks of job protected time off. Now, in order to qualify for these 12 weeks, you do have to work for an employer with at least 50 employees at your work site or within 75 miles. You've had to have been with your employer for at least 1 year, and you must work 1,250 hours in the year prior to your leave. This comes out to about 26 hours per week. During these 12 weeks, your employer would have to continue your health insurance benefits the same way they've been providing them prior to your leave. And I just have a note there because you heard Katie earlier talk about what family members you can get paid family leave for if you're taking time off work to care for them. Unfortunately, this job protection laws have a narrower definition of who family is. So for job protection, you can only have it if you're caring for a parent, a spouse, a registered domestic partner, or a minor child. While this is unpaid, during this time, you may be able to use your paid sick days, get state disability insurance, or paid family leave. Another thing I want people to be aware of, particularly if you do work for an employer that has less than 50 employees, we have state and federal disability laws that give you the right to reasonable accommodations related to disability. So you must actually have a disability, but that can be something such as a compromised immune system. It's anything that substantially limits a major life activity. So you'll see there a common cold or seasonal flu symptoms would probably not be a disability, but complications from coronavirus, such as pneumonia, most likely will be considered that. And as long as your employer has at least 5 employees, you're entitled to these reasonable accommodations. So these reasonable accommodations can take the form of unpaid leave. So that can be an extended unpaid leave, or it can be something like requiring telework as long as you're able to still perform the essential functions of your job while remote. They don't, however, have to continue your health insurance benefits if your leave is a reasonable accommodation. So another area and instance we've been hearing a lot about is I know people are wondering what to do now if their child's school or childcare is closed and they have to miss work to care for them. So there's a couple options. So first, for job protection, we do have a law in California called the Family School Partnership Act that provides employees up to 40 hours of job protected leave each year to deal with school or childcare emergency, including closure by public health directive. The one eligibility requirement is that you work for an employer with at least 25 employees. If you do that, you're entitled to take up to 40 hours. They have to provide it to you and they cannot retaliate or fire you for taking that time. And under the Families First Coronavirus Response Act, there's been additional protections. So starting April 2nd, your employer may be required to provide you with 12 weeks of job protected paid leave to take care of your child due to school or childcare closure. You must have been with your employer for at least 30 days. Your employer has to have less than 500 employees. And if they have less than 50 employees, they may seek an exemption. But if you are covered based on those eligibility requirements, you're entitled to 2/3 of your normal pay rate for up to $200 per day. And again, this is completely paid by the employer. There are provisions in it that will allow an employer to seek tax credits and reimbursement from the federal government for these payments. So those are kind of the main things. I want you to know about some great resources. So if you visit our website, legalaid@work.org, you can go to our work and family page. You'll find our helpline. It's a toll-free helpline. You simply leave a message. We call you back and we do a full intake, and we can provide you with individualized legal advice. So if your answers are not taken care of on this webinar, please reach out to us and we will get back to you as soon as we can. We also have created frequently asked questions to deal with the COVID-19 pandemic that is happening. Right now, those are translated into English, Spanish, and Chinese. Coming soon, we're putting together a list of private resources for undocumented workers to receive funds during this time. As you heard from the EDD presenters, unemployment insurance, because it is a federal state shared program, does require proper work authorization. However, state disability insurance and paid family leave does not have that same restriction. Immigration status, citizenship and immigration status do not affect your rights to SDI and PFL. But for individuals who fall outside of that, there is a lot of private resources that have popped up, and we're going to be putting that on our Legal Aid at Work site as soon as possible. I also put 2 organizations there that have been doing a great job at putting out information about the federal policies that are taking effect, both the National Employment Law Project that has great resources around the unemployment insurance provisions, and A Better Balance, which has great around the paid sick days and paid leave portions. I think it's been said a lot, things are changing very, very quickly. So we're trying to, at Legal Aid at Work, update our FAQs as fast as possible, but it's good to always keep checking back. And then I just wanna end with some tips and a few evolving things that were touched on a bit. So as you heard from the EDD, apply online when possible. That is gonna make your claim go as fast as possible. Request that your payments for unemployment insurance, disability insurance, or paid family leave be put on a debit card. You're offered the option of either having it on a debit card or a check, but if you choose debit card, you're going to receive your money faster, most likely. Just a reminder too that state disability insurance is available if you are experiencing anxiety, depression, or other mental health issues during this time. It does require a medical certification, but if you are, you know, a lot of us I know are dealing with that, and that does qualify you for disability insurance. So I want people to know that. And then the EDD also touched on this, but you'll see listed there 3 potential big changes to unemployment insurance that are most likely to go through. The Senate voted on this last night. At the moment, it's anticipated that the House will approve this tomorrow. So that's the pandemic unemployment assistance. And that will capture everyone who's not eligible for state UI benefits, including independent contractors and those that are self-employed. There's the pandemic emergency unemployment compensation. This will provide the extra 13 weeks of unemployment insurance on top of the 26 weeks you can already get under California law. So that's a total of 39 weeks. And then the pandemic unemployment compensation, which will provide everyone receiving unemployment insurance with an extra $600 per week. And I'll turn it back over.
Thank you so much. Thank you, Jenna. Thank you, EDD, for sharing information resources with us. Just want to share with all, yes, slides will be made available along with other resources. We're going to make sure and get this information out to you. I know there are still some questions. So if folks are not able to get in for testing for COVID-19, what are your responses on that? And could you please elaborate on applying to disability for stress or anxiety?
Sorry, Alejandra, I heard the second part of that question, but what was the first part?
So the first part is if folks are not able to get in for testing for COVID-19, what can they do at this time? And then the other one is the disability for stress or anxiety.
If you haven't gotten tested to get a positive, but you have been consulting with a doctor who, because of your symptoms, has recommended you to quarantine or self-isolate, they can then certify you for disability insurance, even without a positive actual test. But you do have to, it does require a medical certification. So a doctor will have to certify that they have advised you to self-quarantine because of your exposure or because of your symptoms. And stress and anxiety. So what it means that you are experiencing a disabling condition, which can be anxiety, that a doctor in their medical professional opinion believes you cannot perform the essential functions of your job because of that.
Thank you. What if a family member is high risk and at home? Can sick time apply to staying home to care for them?
Yeah, if they're high risk, and that can be considered preventative care then. And I know we are working on getting better guidance around that, but it should be covered currently.
Okay, yes, I have also been getting a lot of questions about undocumented folks. So they can apply for disability and paid family leave. They are not eligible for unemployment insurance.
That is correct. And sometimes there might be potential further issues that arise if you're undocumented applying for disability insurance and paid family leave. If that happens, please reach out to us and we can, generally it should be fine, but sometimes there might be an initial denial for a slew of reasons. If that happens, please reach out to Legal Aid at Work and we can help you through that.
EDD, I do have questions about folks, especially those who have limited English, are unable to get through to people online or on the phone. Any other plans on how you're going to respond to people who are really needing this support right now?
So again, we for disability insurance over the phone, we have English and Spanish. For paid family leave, we actually have many more options available, which if they're contacting paid family leave, they can go through the automated service with the different languages. We are working on having the entire website English and Spanish, but the necessary information right now, claim filing, the COVID-19 information is available in English and Spanish. We have people who are certified to speak Spanish and other languages within the state, and we're utilizing them right now in order to contact people. There is language assistance. Again, that website, edd.ca.gov/disability/SDI_contact, or excuse me, contact_SDI, has the options available if there are alternative language needs.
Thank you so much. I know there are several other questions. I do want to share that this is not a one and done conversation. As Jenna mentioned, there are a lot of changes coming up. I see folks asking about what about independent contractors, differences in being furloughed, laid off versus terminated. Please keep your questions coming. Our plan is to continue having these conversations. We are figuring it out if we can do it every week, every other week. Things are changing rapidly, so we want to make sure and get you all the information that you need. Please enter your questions into the chat. I do want to transition over to Idepska, who will be talking to us also about, being culturally responsive during these times. Do you have a PowerPoint?
I do, but given the time, I can just go through my.
Do it.
Do it? Okay.
Go for it. Thank you.
So I do want to talk a little really quickly. Hi, my name is Megan Ortiz. I'm the Executive Director of Instituto de Educación Popular del Sur de California, IDEPSCA. We work specifically with day laborers and domestic workers in the Los Angeles region, but are also part of the California Domestic Workers Coalition and the National Domestic Workers Alliance. So I just want to really quickly, and I've been reading a lot of the comments, just echo some of the issues of exploitation, exclusion, and enforcement issues for undocumented workers during this time. And also just share some of the things that are in motion on the state level to hopefully deal with some of these issues. So first of all, I just want to say that you're not imagining if a lot of these challenges that I'm hearing, feel almost like exclusions. I think it's really important to know that historically that workers such as domestic workers and farm workers are purposely left out of federal labor standards acts. And this is a legacy of slavery. So I think it's really important to know that. In California, there's been, an effort to extend more benefits to excluded workers. It was only just in 2013 that overtime rights were extended to personal caregivers. Although this is also not at the regular overtime rate. We know that especially right now, when people actually some people don't have the option to not work, there is a concern about occupational safety and health, and how that is going to be protected. One of the challenges we have is that the California Occupational Safety and Health Agency explicitly excludes health and safety protections for household workers and day laborers. And this is an issue that we saw come up in other disasters that we're familiar here with in California, the wildfires, which is something that we worked on directly. The other challenge, which has been, someone has some funny noise in the background, which is great. It was already shared, unemployment insurance being tied to payroll taxes and legal status. So that is a challenge for many workers right now. And additionally, there's a very real reality that many workers continue to get paid in cash. So the extension of benefits does not apply to them. As was noted also by other people in the comments, the access to healthcare is limited. People cannot get enough tests, but we also know for the undocumented community, access to healthcare is extremely limited. They are excluded from ACA, although in California, there have been great strides to include different portions of the undocumented community. But even though there are some really great county programs, certification can be a challenge for disability and leave programs because of that access. And finally, we heard a lot of the best ways to access these benefits is through the online portals. While most people do have smartphones, there still is a huge digital divide, especially for our immigrant undocumented population. So we need to recognize that and find other ways, especially during these disaster moments, which is what we're at right now. Just highlighting some areas of possible exploitation. We're not clear, who exactly is exempt from safer at home guidelines. We know that workers, such as day laborers and domestic workers, people who are caring, I've heard like moms at home, right? Are concerned about how they're going to be able to survive taking care of their children. And it's not clear how these exemptions are actually working, as this is a constantly unfolding thing. And we're also worried about enforcement in terms of that on the street. Because when work is happening in private homes, there's also, there's been a lot of information on how to protect yourself, but how do you protect workers, right? If your workplace is someone else's home. So that's a huge issue. And then another issue is that we already know that California has a huge rate of wage theft. People are not even getting paid the minimum wage. People are not getting paid overtime. We know that in disasters, and we know this from our experience during the wildfires, that, living day to day, a lot of times unscrupulous employers will use disasters as a reason to not pay past wages owed. So it's just really important to keep an eye on that and keep tracking if you are working. Keeping your own, log of hours will work and does work as evidence when and if you have to file a wage claim with the state. I think finally, there are some solutions that we are looking at on the state level. There is a bill right now at the state level seeking to lift the exclusion of day laborers and domestic workers from Cal OSHA protections. We are also talking with the state right now to see if it's possible to have an EDD operated benefit fund specifically for undocumented workers. We're also looking at models that have been used by the State Department of Labor to consider disbursement to organizations that work with workers, like some of us represented here. So we can give disbursement of financial support to workers. This is something that many organizations, such as ours, did during the wildfires. But obviously the scale of this is much bigger, so we're going to need a lot more support than private foundations that gave during the wildfires specifically. We're also talking to different municipalities about municipal disbursements specifically for undocumented workers. And I think right now, while this is a crisis in the moment, it's also an opportunity for us to think about longer term solutions, right? Thinking about what does it look like to have benefits programs that are not tied to an employer or one place of work. The National Domestic Workers Alliance is a very interesting model called ALIA for paid sick days. And also thinking about universal care. This is something that Caring Across Generations, another coalition, has been working on, specifically in California. How do we make sure that everyone, not just in times of crisis, has access to childcare and home care for their families and for themselves? I've just quickly put my contact information up there. I can be emailed, and I'll share these slides out. But I think right now is, the time also for us to come together and think about how we support our most vulnerable, and also think about longer term solutions for when we come out of this crisis. So we're not waiting for the next crisis for us to solve these longer issues in terms of unemployment, benefits, and disability. Thank you. You're muted, Alejandra.
This was
Thank
great,
you.
Alejandra.
Thank you so much. Great conversations. Again, this is not going to be the last. Please keep entering your ideas, questions into the chat. Yes, we were going to continue having this conversation. Yes, we are going to make resources available. There are ideas about, can we add some of these questions to a platform or space somewhere to be able to ask or to be able to share these with each other? Yes. Please, if you did not register with your email, add your email into the chat so that we have that available for you. In the meantime, Jenna is going to answer some of the questions that are coming up in the chat.
Yeah, I just typed an answer, but I know there's a lot of questions regarding independent contractors and 1099 workers. So as I stated before, the federal government is currently working on an extension to UI and a new program that would allow these self-employed and independent contractors to access UI benefits that they otherwise would not be entitled to. But in addition to that, I want people to know that even if you are paid on a 1099 and your employer has considered you an independent contractor, that doesn't mean you actually are an independent contractor. California law, particularly in the last year, has changed, and most people under California law are actually employees, and you've simply been misclassified. And so what you need to do is, if you believe you've been misclassified, unless you truly are an independent contractor, you should apply for unemployment insurance, apply for paid family leave, apply for state disability insurance. What may happen is you'll get an initial denial, but then you appeal that and you provide proof of your wages, and the EDD will make a determination whether you have been misclassified or not. If they determine that you are actually an employee under California law, you will then be entitled to the benefits, and they will go after the employer to recoup any benefits that should have been paid. So I encourage everyone to apply. If you think there's any chance, just simply apply, and a determination will be made at a later date.
Hey, this is Gerald from Unemployment Insurance, EDD, UI. That is totally true. I agree. So we do have a process in place where if you apply for unemployment insurance and you believe that, even though you're classified or misclassified as an independent contractor, we take all that information for you. And we do actually have a process in place. It's a tax audit technically. And once we set that up, we file a claim for you, then we do our processes on the background. And then when it comes to a tax auditor, then if they need additional information from you, they will send you an affidavit of wages, and then it will give you a chance to submit proof, W-2, or other tax documentation. So it's also a process that we have in place to determine eligibility if you're misclassified as an independent contractor. So, but thank you, Jenna, for that information, actually.
Yeah, thank you for following up on that too. One other question I just saw is someone asked if the coverage that was mentioned applied to domestic workers, for example, house cleaners. So I'll just say, it depends on the many things we discussed, but the laws that provide for job protection or allow you to get reasonable accommodations for a disability, all of those apply to every worker, regardless of immigration or citizenship status. The legal employment law protections apply to all employees. And that means that includes paid sick days. And as long as that house cleaner is getting paid on a paycheck that the deduction for state disability insurance is being taken out of, they can also get state disability insurance and paid family leave. But if they are getting paid in cash, then unfortunately they don't have access to those the paid family leave and state disability insurance.
Thank you so much. I did ask a question in the chat, again, because we're going to keep this conversation going. What has been most useful from today? Please let us know what was helpful. What would you like to have further addressed next time? What did we leave off? I know there are a lot of questions getting into specific claims. Unfortunately, we don't have time for that today, but there are questions of if I need specific answers to my claim or my situation, where can I go? So add them in here if you feel comfortable. If you don't want to send it to everyone, you can just send it to myself, Alejandra Aguilar, and I can capture those and we can address them later. I did share also, we have in partnership with the California Work and Family Coalition, we're working on facilitating some trainings that are going to further deepen these conversations on how we can engage other folks in learning about accessing paid family leave, who qualifies, how do we get people access to information in especially these times of social distancing? What are ways in which we can communicate all of this through our social platforms, media advocacy? We were talking Monday and Tuesday with Univision locally about folks are not sure what to do and what is state and what is federal, which do I apply for? The application for most of these it's in English online and they're hard to understand. So how do I fill it out if I'm not sure? All of that we're going to get into with the trainings. They're on the Work and Family Coalition page. Feel free to register. It's a webinar series taking place April 17th, 22nd, and May 5th. We're hosting the English ones in the morning and the Spanish ones in the afternoon for folks to engage in some deeper conversations there. We will be having these, I think we're gonna start calling them town hall forums. It's what I'm hearing from folks. Like it's more of a town hall forum. Let's just get our questions asked, answered. Yes, so I'm available to stick around, and I don't know if others are for questions and other answers if folks have some. What's coming up for people?
Hey Alejandra, this is Jenna. I just know I see a lot of people in the chat talking about looking for kind of flow charts to go through this. I will say, unfortunately at the moment we don't have that, but we are working hard on creating flowchart like infographics, trying to make this digestible as possible, specifically applied to COVID-19. We are also potentially exploring creating a chat bot that would kind of create a flowchart. So we agree with you. We think that's an excellent resource, and we're hopefully can try to get that done as soon as possible.
Anything else? If you have a question you'd like to ask, please unmute yourself and have at it. I mean, we've got the EDD here. We've got legal aid at work. Ask.
This is Jenya. One thing we could do is take some of these questions, and I can tell there's a lot of need for follow-up and the follow-up email, and then also have that sort of help us craft kind of what we're doing next, both in the coalition and in these different joint, and also it'll inform what we do in the upcoming trainings where people might want kind of deeper information that they're sharing out to their communities. So that's just one idea of handling. There's a lot of questions.
Well, there were questions about jobs. So
if there's time, this is Anna from Early Edge, California. Our organization is an early learning advocacy organization, and we work with a lot of family child care providers or providers of small preschools or small child care centers. So wondering what resources are available for small business owners. Definitely less than 50 employees.
Hey, this is Jenna. I can briefly answer that. Unfortunately, we usually focus on the employee side, but the small business majority is a member of the California Working Family Coalition. And right now they are putting on a ton of webinars and putting out great resources for small business owners as we all try to, digest and understand all the federal changes and opportunities that may be available. So I would recommend checking out their website. I can try to put it in the chat, a link to it.
Thank you.
I'm seeing a lot of questions also for undocumented immigrants. We are also going to be working on hosting something similar in Spanish for folks to understand all of this. Where do they go? How do they access it? And I know that gets into some other items as well, which we will be addressing. And if there are needs for other languages, please also let us know, because we can also work on that. From us at the partnership, we're also going to be working on sharing resources for folks on how to manage financial stress, how to manage stress during these times. Again, if we are in our homes with children, family members, it does increase the level of stress, which again is a risk factor for violence at home. So we want to engage folks in conversations around how to manage difficult conversations, especially with children around. How to practice some self-care, how to practice some boundary setting during these times. So we're going to get those out to you all so that you can have them accessible to you, accessible to community members. For UI, do I need to remove myself from IHHS to receive benefits, or does the recipient of my care need to let me go? Or can I continue to do IHSS as long as it's safe and still get benefits?
So IHSS, In-Home Support Services, is also an employer. It's similar to if you're working, say, at Target. Do I quit so that I can get unemployment? That would be the same question. But if you're underemployed, right? So if you quit without good cause, you may get disqualified for unemployment. But I think what they're asking is, can I apply for unemployment? Unemployment or underemployment, you can claim for benefits. As long as you're working part-time, then what happens is when you apply for benefits, then you report to us on this claimant certification form every 2 weeks that you're working, and you report how much money you've made, and we deduct part of the wages that you've earned from the weekly benefit amount. So IHSS is no different than any other employer. In an IHSS situation, your employer is the person that you're giving care to, the caregiver. That's considered your employer. I hope that answered that question.
Would you mind continuing on that topic? Folks are asking about, I've had a reduction in hours, but not a full loss of job. What does that look like?
So what it is, again, for unemployment, if you're totally unemployed, then you get the weekly benefit amount that you're entitled to. But if you have a reduction in hours, it really all depends on how much money in gross earnings you've made. Because again, it's deductible generally from unemployment, from the weekly benefit amount of your unemployment insurance claim. That really is there all is to it. If you decide to quit one employment, say you have multiple employment, and if you decided to quit one of them, that's really on you. But as of the time, eligibility is determined based on the last employment. So if you're working part-time for multiple employers and you decide to quit from one of them, you're still technically employed. You still have to report the wages you've earned from the other employment. So employment in general, remember, you claim benefits on a weekly basis, right? Even though it's a biweekly claim form, you claim it. Part of the question on the claim form is, did you work or earn any wages, whether you got paid or not, on that weekly certification or biweekly? Each week you have to answer individually. So if you have 3 part-time employment, as long as it's not as low of 60 hours, because that would be considered full-time if you're working 20 hours each for each employment. But if you had, whether you had 1 or 3, or if you quit from one of them and you had 2, At that point in time, you still need to report the wages from the other employers. Am I understanding that question, or am I clear on that by any chance, or?
That seemed clear. If folks are still having questions or that was unclear to you, please just unmute yourself and ask the question or type it into the chat.
Oh, hey, Alejandra, this is Jenna. I just wanted to quick put out there that we did just get clarification from the EDD because we had asked this question that a doctor can certify using telehealth. So you don't physically have to go into the doctor. They're taking a liberal interpretation of that. And so your doctor can see you virtually to be able to certify. And then they can do the certification either online or they can print out a copy and mail it in. But that's important. And so that would be for state disability insurance and paid family leave.
Okay. I think the majority of the questions were answered. The rest seem to be very specific to individual claims. I'm trying to look for any other items I've missed. Jenna, if there's anything else that you are seeing that you would like to address before we close out.
No, this is great. I think there'll be a lot of really good follow-up. It's really going to help us in designing any next steps. Thanks a lot, Alejandra, everybody.
Can I just say something really quick, Alejandra? Is that okay?
Absolutely.
Yeah. I just want to let people know, because a lot of times when we have conversations like this, we end up learning or remembering what folks are left out of these kinds of legal protections. And the California Work and Family Coalition is doing legislative advocacy in partnership with a lot of the folks on this call to try and make sure that more people are covered by legal protection. So if you go to our website, there's a way that you can find more information about that. And I'll put my email in the chat, and you can just email me directly as well if you'd like to be part of that work. But this was amazing.
Thank you. This is great. I am getting a couple of messages about when will we be able to regroup. Can we have our questions answered maybe through a different space for all of us to see the answers to each other's questions? Yes, again, if you did not register through your email or the way in which you would like to be contacted, please enter that into the chat box now so that I can have it available. You are also able to save, if you are on a computer, you are able to save the chat. On the right-hand side, there are 3 little dots. If you click on that little dot, you can save your chat and it saves it to your computer so that you can have that for reference of all the links as well that were shared. We are going to make this available. I'm hoping that we can download it right away so that we can have the full hour and 15 minutes saved for you all to watch and listen to later. Thank you so much. I am so appreciative of all of the partners coming together today to engage in these conversations. Thank you so much for the California Work and Family Coalition for bringing us together. Jenna, Legal Aid at Work, thank you for your awesome presentation and answers to all of our questions. Megan from IDEPSCA, thank you so much for reminding us to be culturally responsive and focused on the needs of the most marginalized. I would love to keep this conversation going. Also, we've got some work to do, folks. There are needs that need to be taken into account, legislative advocacy that needs to happen now. There is nothing like a crisis to get us to change our systems. That's what we're in right now. So please stay informed, stay involved. Sent you all the information. We will be in contact with you. Let me see if there's anything else that's coming up. Yes, we were going to send you out also a message with the webinars that are coming up April 17th, 22nd, May 5th, English in the morning, Spanish in the afternoon. We're going to be using a paid family leave training toolkit with all of the resources and information in English and Spanish for folks to use. Thank you. Please stay safe, stay healthy, take care of yourselves. Don't forget to breathe, move around. It's important that we take care of our bodies, especially when working remotely, because we tend to spend a lot of time sitting down. So thank you. Have a wonderful day, wonderful rest of your week. Bye, everyone.
Thank you.
Thank you.